bacteria individually. As we have already done the classification, and we know that the gram-positive can be divided into cocoid, branching and rods. These cocoids on catalase test can be divided into catalase positive and catalase negative. The catalase positive are the Staphylococcus and catalase negative are Streptococcus. These Staphylococcus on coagulase test are coagulase positive or coagulase negative, that is S, E and A, that is the aureus, the epidermidis and the saprophyticus. Staph saprophyticus, staph epidermidis and staph aureus. So we will take the gram-positive individually, starting with staph aureus, epidermidis and saprophyticus. So now we know that the staph aureus is catalase positive and coagulase positive. So staph aureus is catalase positive and coagulase positive. Staph aureus, to remember it in a very easy way, you should remember times. That is staph aureus. To remember staph aureus, times. What is times? Times stand for T-I-M, E and S. Now times T-I-M-E-S stands for, this T actually stands for toxin, this I stands for inflammatory, this M stands for MRSA. What is MRSA? Methicillin resistant staph aureus. Now, the toxin which is produced by the staph aureus, what does it do? It does toxic shock syndrome toxin. It does produce enterotoxin and it causes scalded skin syndrome. So this toxin is producing three things: toxic shock syndrome toxin, enterotoxin and scalded skin syndrome. Inflammatory, what inflammatory disorders is it is causing? To remember the inflammatory causes, remember PACE OA. What is PACE OA now? The inflammatory causes are PACE OA. To remember the inflammatory causes, mnemonic is PACE OA. And what does PACE OA stands for? P. Staph aureus causes pneumonia, especially in individuals which are suffering with the infection of influenza. Staph aureus causes, A is for abscess, abscess in organs. Staph aureus causes skin infections, and staph aureus is one of the most important causes for causing endocarditis. Which endocarditis? Acute endocarditis. Acute endocarditis is the endocarditis which is actually inflaming the valves of the heart, which are normal. There is no disorder to the valve. If some vegetation is growing on the normal valves, it is called acute endocarditis. One of the most important causes is staph aureus. O and A stand for osteomyelitis and A stands for arthritis. Which arthritis? Septic arthritis. So now you know the toxin is producing TES, that is toxic shock syndrome toxin, enterotoxin and scalded skin syndrome. Inflammatory disorder caused are PACE OA, pneumonia, abscess, skin, endocarditis, osteomyelitis and septic arthritis. Coming to MRSA, that is methicillin resistant staph aureus, it is one of the most common causes of causing nosocomial infections, that is hospital infections. So staph aureus, these are the three things which staph aureus is doing. Now let me talk a little bit about toxic shock syndrome toxin. Toxic shock syndrome toxin. toxic shock syndrome toxin presentation, it is caused by the toxin produced by Staph aureus, which is an exotoxin, and the presentation, patient will present with fever, he can present with vomiting, can present with a rash leading up to shock or end organ failure. Toxic shock syndrome toxin is usually seen in people using nasal packing or vaginal tampons. Enterotoxin of the Staph aureus is very important to remember because it is not destroyed like other exotoxins even at 60 degrees Celsius. And this will produce vomiting within 2 to 4 hours of ingestion of the toxin. Scalded skin syndrome is the third, which is also produced by a toxin. Inflammatory is PSOA and methicillin resistant aureus is nosocomial infection. Now we will take the second one is the Coagulase negative, and the Coagulase negative are Staphylococcus epidermidis and Staphylococcus saprophyticus. To differentiate the epidermidis from the saprophyticus, we already know there are two Coagulase negative, that is epidermidis and Staphylococcus saprophyticus. To differentiate between these two, we use novobucin. Now novobucin, Staphylococcus epidermidis is sensitive to novobucin and saprophyticus is resistant to novobucin. What is Staphylococcus epidermidis doing? It is one of the most common organism which resides in the skin. So it is very easy for the epidermidis to infect the catheters, prosthetic valves, so if there is any infection with the implant or with the catheter or with prosthetic valves, the most common organism is Staphylococcus epidermidis. What is the saprophyticus doing? Saprophyticus is the second most common agent to infect urinary tract. After E. coli, saprophyticus is the second most common agent to infect the urinary tract. This brings to the end of the Staphylococcus